This video will explain how to document discharge summaries in Meditech. This is a two-part task because you will need to do the record non-visit documentation to document your discharge summary, and then you'll need to go into add update orders to clean up the care plan and the schedule if necessary. The way that you'll do that is, first step is create new task, record non-visit documentation. You're going to search for your patient that you need to document on. Then come over to Start Documentation. Once you're on this page, you'll just click your resource class. In this case, I'll be a physical therapist. Then you'll come over to the document page. Now, the document page will not have the care step you need in the branches of the tree. You're not going to have it here. So all you need to do in the care step search is type in discharge and then hit enter. A search box will come up, and all you need to do is add the transfer death discharge overview assessment to the documentation. So you could just click add, and that care step will come here below. This is the only care step you need to document on. So once this care step appears, you will write your discharge summary here in the notes section. The discharge summary should include information about the patient's status as the last visit and the reason for discharge. So if the patient is being discharged due to a missed recert, patient has met their goals. If the patient is being discharged because managed care is no longer approving services, you cannot write discharge as per insurance. You should be writing discharge as per MD orders because we can't discharge without the doctor's orders to do so. So the discharge summary is going to be documented here. Once you complete that discharge summary right here, there's no need to touch anything in these boxes or click any of the go-tos. You're just documenting it right here. Then all you need to do, you will need to do a communication because you want to send a team communication to everybody on the team. So the reason that you can choose is discharge. If it should be in the drop down in live. If not, write the word discharge. The method is going to be team communication. You're going to send it to all team leads. And I would include your supervisor. Now here you can also write a brief note about the reason for discharge and anything that you feel the team needs to know about your discharge. Your last date of service, any pertinent information will go here in this box. So then you would go to the complete documentation page. The documentation reason will be discharge, and you can just apply your signature. Do not click initiate discharge here. For rehab services, this is discharging the patient from the agency. The nurses only work on that. We are not discharging from the agency. All we are responsible for is discharging from rehab. So please do not click this box, even if you think it applies. Apply your signature and then hit finish. Now, part 2 of the discharge process is to go to either add update orders or you can use modify review care plan. Modify review care plan has the same information. So once the modify review care plan task opens, you'll again search for your patient, and then you're just going to jump right to the care plan page. On the care plan page is where you're going to indicate if your goals were met or not met. If you're being replaced, you can skip this step because the patient will still be receiving your services and the next therapist will be able to utilize the goals that you are leaving in progress. The only time you need to go in and change the status if you're discharging the patient from therapy, but the patient is remaining on program, just not getting your service anymore. So in that case, you would click on each care need and you would check met or not met. So in this case, I'm going to say this patient has met all of their therapy goals. So you would just come to all of your goals and interventions, goals and care needs, and mark everything as met. And you would do that for all of the goals and interventions and care needs in the tree. The next step, once you make all of your goals met, is resource plan. If you are no longer going to be on the case, you are no longer going to be the lead clinician. So you would, if your name is here, you would take out your name. You want this field blank, so that way it'll be there available for them to put in for the next therapist on the case. If the patient is no longer going to be receiving your service at all, the patient is staying on program, but is not going to be getting your service, you can change the resource class status to discharge. If you're being replaced on the case, leave it as active so the next therapist will have the resource class available. So in this case, I'm changing it to discharge because the patient is staying on program, just no longer receiving physical therapy. So I change the resource class to discharge. And then on the patient schedule, you can remove your name. If you're being replaced on the case, your name may no longer be on any of the future visits. But if there are visits there that you're not planning on doing anymore because you're no longer on the case, you can just backspace your name. And if you're going to be replaced, you can just put the word place in and reassign that visit to the employee called needs replacement. That will just give the case placers a heads up that you need to be replaced. If you're no longer going to be seeing this patient and you're not being replaced, just take your name out and it'll just fall off of your schedule. It'll still stay on the patient's schedule until the nurse discharges the orders or the patient is fully discharged. So that is what you need to do in the care plan. You need to clean up your goals and interventions on the care plan. Either mark them as met, not met. If you're being replaced, leave them in process. The resource plan, you would just come over to your discipline, take your name out as the lead clinician, and then if you are not being replaced, change the status to discharge. And on the schedule, remove your name from them. And if you are being replaced on those visits, you can type in the employee replacement and hit enter and reassign those visits to the needs replacement employee. So that is how you do a discharge in Meditech.